Hello and welcome to the Toronto Star subscriber event. Our topic today is kids and the pandemic, vaccines, schools, and mental health. My name is Raju Mudhar. I'm a longtime Star reporter who is now one of the hosts and producers of our daily news podcast, This Matters. Please listen to it if you ever get the chance. And I'll be moderating this discussion. It is my pleasure to welcome our distinguished panels. We have two incredible medical experts who, quite honestly, have credentials as long as my arm. We have Dr. Anna Banerji from UT, who's a pediatric infectious disease specialist, among many other titles, who is actually joining us from a vaccination clinic. So thank you so much for making the time. And then we also have Dr. Upton Allen, who is division head of infectious diseases at the Hospital for Sick Children and is also a professor at U of T. And then from the Star, we have two stellar award-winning journalists and two of my favorites to always talk to. We have Kris Rushowy, who is a Queen's Park reporter and formerly an education reporter. So she'll tell us everything about schools. And then we have Jennifer Yang, who is an incredible health reporter who has been covering several aspects of this pandemic. I want to thank you all on the panel for joining us today. And then, as a journalist, I also want to give a shout out to all the readers who submitted questions. As someone who does this for a living, I have to say I am impressed by their breadth and quality. So we're going to get to them in a minute. I also want to thank everyone who's joining us today for this discussion. So without further ado, let's get rolling. The first question, and we have quite a few, but it's about vaccines, safety, and children. This is from Kelly Halfling, and her first question is, fortunately, children have in the overall population had less fatalities and serious illnesses overall due to COVID. The statistics for testing on the vaccine on young children seems a very small sampling, so there are concerns that we don't know the long-term side effects of this type of vaccine on children. How can we feel confident that it is necessary to vaccinate young children, and how young do you feel it will end up being approved for? So, Dr. Banerji, can we start with you there? How would you respond to that question?
So we don't really know how many kids have had COVID because at the beginning of the pandemic, a lot of kids were not tested. I mean, kids, when they do get COVID, they usually have mild symptoms and may have no symptoms at all. But when you look at the numbers, you've had at least 1,100 kids in the hospital with COVID. We've had 145 kids in the ICU and 12 deaths. So it's not insignificant. Also, kids can get COVID, they can transmit it to each other, and then they can get it from the community, but they can also spread it to the community. And I've been calling people with COVID for the past year, and I've seen tons of families where the kids have it, and again, it spreads to the family or to other people. And how young? There are studies, like right now it's approved 12 and above, but there are studies, ongoing studies, as low as 6 months being done through Pfizer and Moderna. And I guess we'll get the results out in the next months.
Kelly had an interesting follow-up question, and it's one that, first seems silly, not silly at first, but it's one of these things that, the question is in adults, we all receive the same dosage of the vaccine. It seems the same with children up to 12 to 15, but will the dosage be different for a younger child? Dr. Allen, can you handle that?
Well, studies are being done now to determine the right scheduling and the dosage of the vaccines that are needed for children. So decisions regarding the number of doses, intervals between doses, and also the actual dosage are derived from the clinical trials that are being done at the moment. It's important to recognize that those clinical trials provide important information relating to how well the vaccines might work in children, how safe they are. But once the vaccines have reached arms, that there's a surveillance mechanism that is put in place to detect rare side effects, if any do occur.
We have a ton of questions asking when will my child get vaccinated? I'm not sure if you guys can give a definitive answer on this, but Rabina Raji says, asked the question, when will Ontario roll out vaccine to kids 12 and up? Alberta's already doing it. And if they roll it by the summer, should kids get the second dose before September and before going back to school? To the doctors I go. What do you think about this?
So I don't know. I mean, I'm hopeful that Ontario starts vaccinating kids 12 and above as soon as possible. And then if they can get at least one dose in through the summer, in the first few weeks of school, they might be able to get a second dose in. But I have no idea really what the plans are. But I think that, one of the easiest ways to vaccinate kids is to do it through a school-based program. You get all the kids going to that middle school or high school, and you basically line them up, give them their vaccines, the second doses, and that's the most efficient way, rather than having the kids find vaccine clinics, or pop-up clinics in neighborhood. That's probably the way it's going to happen, but I really don't know.
I think vaccine has. Oh, sorry, Dr.
What
Allen.
we've been told is that for 12 and above, hopefully by the end of May. But it's important to recognize that this is all dependent on supplies. But I suggest that we step back a little bit in the sense that it's really important, I believe, to recognize that in protecting children, we need to consider other strategies besides vaccinating the children themselves. That's important, and we should do that. But we also need to ensure that the level of COVID in the community is kept low. And we also need to ensure that people who are involved in the care of children are also protected. So we develop a protective ring around a child in addition to reducing community transmission.
I think vaccine hesitancy is something that has become an issue for a number of people. Carmen Muzo writes, I have a teenage daughter and I'm currently undecided about whether or not to move forward with a COVID vaccination or wait a few months. I am vaccinated and I believe in science. However, the vaccination rollout in Canada has left me weary and concerned. I'm jaded about the adult experience and I'm just not convinced that my teenager should rush to join this less than stellar vaccination process. To the doctors, Dr. Upton, what do you have to say to that?
Yeah, it's a great question. And whenever one thinks of vaccinating anyone, whether it's children, adolescents, adults, it's always a benefit-risk trade-off. And the consensus at the moment really is that the benefits far outweigh risks. And so I would suggest that it would be appropriate to proceed with vaccination when the right time arrives and supplies are adequate. But it's also important to recognize one of the challenges that we face in Canada is that there are certain regions where the prevalence of COVID is higher than in other areas. And so a teenager in a hotspot would be at greater risk compared with a teenager who's not in a hotspot. So there are several factors that are being taken into account in the rolling out of vaccines, and which should be taken into account by families. What we really want to know, though, is to ensure that families have the right information regarding what vaccines do and what they don't do, and also the right information with respect to safety. At the end of the day, one wants to make sure that if someone decides not to be vaccinated, it is based on the right information and not wrong information. That's really key moving forward.
The grandparents have entered the chat. We've got a couple of questions from grandparents asking about, they've received one dose and they're wondering what precautions and when perhaps they can start hanging out with their grandchildren. So we have Julie Frawley. She writes, my husband and I are over 70. We had our first shot. Our daughter has her first shot, and we just want to know when we can be safe to be close to her, or should we wait until we have our second dose? And then we have Eliza, and her question is with the variants, are the COVID-19 symptoms or burden of disease any greater than with the original strain for children? And basically as well, when can they hang out with their family members? Dr. Banerji?
So I would say for the grandparents that have had one dose, that I would wait and maybe hang out with their grandchildren outside, still with a mask. I mean, having one dose greatly reduces the risk of getting COVID, but more importantly, it reduces the risk of them being hospitalized and dying. But a second dose really helps boost that immunity. So if at all possible, I would just hold off a little bit longer as far as having hugs and close interactions with the grandchildren. Part of that also depends on the prevalence of COVID in the community. A few weeks ago, we were at the highest rates we ever had, and now it's coming down. So maybe things will change in the summer and the risks will go down. But I think it's safer to have 2 doses of vaccine.
Okay. You brought up outside, and Stephen Beaconsfield, who I believe is a gym teacher, is wondering, because of the variants, I'm wondering if my gut feeling and continue to push hard for kids to be outside as much as possible. Is that solid advice even with the variants? Many of his kids are in apartments, school kids, and the elevators are some concern for transmission. How to minimize these possibilities of transmission beyond the obvious? Before I get to the doctors, I actually kind of want to bring in Kris over here, because the government has been saying some interesting things lately. One about summer camps, and also potentially other outdoor activities may be opening before this June 2nd, the date that's been sort of pushed around. So Kris, can you shed some light a little bit about that? What's going on with summer camps? And yes, maybe, I don't know how many kids golf, but some of them might be wanting to hit the links as well. What's going on with that?
Okay, so my son actually got a job at a golf course, so he's very eager for them to open up. But what we saw on Sunday was Premier Doug Ford kind of took everybody by surprise and said that the summer camps were going to open, that it was his plan that they would open this summer. It was later clarified that he meant day and overnight camps. So that's something that the province is looking at, which is, good for kids. Everybody seems to think, this is a good move for kids, for families, and also for teenagers, right? Who need the work. So this is the thing that we're looking at now. I mean, typically summer camps start operating early July. So that's sort of what everybody's looking forward to right now.
Dr. Allen. So the question though is even with the variants, should everything outside is safer? I guess, how safe is it?
So generally speaking, outside is much safer than being indoors. But that's the first point. The second point, though, it's important to recognize, it really depends what you're doing outside. And so if you're in a crowded environment outside, then you are still at risk of transmitting infection or picking up infection. So a lot depends on the spacing outside and the types of activities that you're doing. But generally speaking, being outdoors is certainly much safer than being in a closed indoor environment.
Jenny, we're coming to you now. We've hit the daycare portion of our chat today. And, let's just start with a question from Ruth McCaughey. How safe is daycare right now for children not old enough for those eligible to be vaccinated?
So that's a great question. And to be honest, it's a top of mind question for all of my friends in my social circle, because I'm kind of the age now where all my friends have little kids in daycare. And myself, I have a child in daycare. And, people who follow me on Twitter will know that our own child actually picked up COVID, likely from her daycare. So this is very much a top of mind question for me. And also one of those examples where, as a journalist covering COVID, often the topics we write about tend to creep into our own personal lives as well. So it is sort of interesting to be reporting on something that affects me so personally. But, I was very interested in this question, is daycare safe, about a month ago. And, when I looked into it at the time, if you look at just the province's publicly reported data for confirmed cases linked to childcare centers, in this third wave, they have reached unprecedented levels. It still looks small numbers relative to the total number of kids enrolled in daycares, but they were at highs we've never seen before. And I do think that there are a lot of barriers to allowing us to see clearly exactly how much transmission might be happening in daycares. And I think there are a number of problems at play. One, I think a lot of barriers exist for parents to take their little kids for testing, even when a public health unit might be recommending them for testing because of an exposure. There, anyone who's had to take their 2-year-old for COVID testing knows how painful it is for everyone involved. Secondly, it's really hard to, I think, confirm when a 2-year-old who has confirmed positive for COVID got it in the daycare setting or might have got it from the community or for someone in the household. So I do think there are probably a lot of kids in daycare who test positive where it's very unclear where exactly they might have picked it up, even if it was in the daycare. So those cases might not be reflected in the official numbers. So, I think when I looked at this a month ago, it was when the third wave was not even peaked yet. And, speaking to experts, including Dr. Banerji, they were saying that they were seeing more cases linked to daycares. Dr. Janine McCready at Michael Garron Hospital said that she was seeing more cases linked to childcare centers and more cases where the daycare exposure ended up infecting other members of the household and other members of the daycare. So at that point in time, Dr. McCready's strong recommendation was that parents who can pull their kids out of daycare should think about doing so, because it just reduces their risk and the risk to everyone in the daycare community at a time when community transmission rates were at unprecedented levels. And, since then, we have seen things settle down quite a lot more. And, there are really great measures in place in daycares to try and ensure that everything is as safe as possible. But I also recognize that I think daycares are a little riskier in some ways than a classroom with older kids, because these little kids can't mask. They require such close contact to take care of. And, things happen. Little babies sneeze in your face. And they, play with each other in a way where they can't really be physically separated. So, I think we don't have the data we need to really have a very clear and crisp view of exactly what daycare risk is or the extent to which transmission occurs within the daycare setting. But I think we know that community rates are coming down. And as Dr. Allen mentioned earlier, it's very important to look at your local context, how high are community transmission rates in your area. But the other thing that's now happening that I think is going to make daycares even safer is the fact that childcare workers became eligible for vaccination April 29th. I think we're now like 3 weeks out from that. So hopefully many daycare workers have now had a chance to get their first shot. And so, as they build up immunity and as they get second doses, I do think daycares will just get even safer. But that question, is daycare safe? It's a loaded one, and it's a complicated one because it's so dependent on the context and what's happening in your area, and also, what the risks in your own life are. If, for our family, our only exposure to the world really, because we work from home, was our daycare. And we did that because we needed to keep our kid in daycare. It was the best thing for all of us. So to compensate for that elevated risk, we shut down all of our risks and exposures in the other aspects of our life. And so it was a constant sort of weighing of that. And I think for families now thinking about this question, you need to sort of try to do that for your own family and context as well. No single answer for everybody.
Listen, there's no easy answers with any of this.
Yeah.
I think that's one thing that COVID has taught us all. Okay, so Jenny, I'm going to stick with you as well, because I think this is something that we chatted about on one of the episodes of my podcast, and it's about testing of children and how we can make that a little bit easy, particularly for the little ones. This comes from Doug Price. And basically, he's like, why has Public Health Ontario approved the nostril-only swab collection method not in wide use, especially for daycare-age children? I have a 3-year-old granddaughter that lives in London, Ontario, who's been repeatedly subject to the NP swab, always negative, and is now terrified of anyone in a white coat. She must be physically restrained by her mother while she screams in terror as the poor nurse tries to take the sample. There's got to be a better way. Now, this is something you recently wrote about, and I believe that there is a program at the hospital for sick children as well that's sort of trying to help this. But Jenny, is this something? Can you tell us a little bit about this, and then how can perhaps maybe we can make this a bit more widespread, or at least more people know about how to make this a little bit easier?
Well, first of all, I want to say hi to Doug, who sent me emails about this. And I know he's and I'm sorry, I don't think I've had a chance to respond to you yet, Doug. So I'm glad I can speak to you now face to face. Absolutely. This is such an issue. And Doug, I really feel for you and your family. I've had to take my child for testing multiple times now, and you do literally have to restrain them. And it's the worst feeling in the world to be holding down a 2-year-old's arms while she's screaming in fear. A friend of mine has had to have her 3-year-old tested 10 times. And it's at the point now where she starts trembling uncontrollably when they show up at the COVID center. And I think in my recent story, there was this poor little boy whose first words, one of them, was COVID ouchie, because he'd been subjected to so many nasopharyngeal swabs. It is such an unpleasant experience for families and their toddlers. And I do think it's a barrier to improving testing uptake rates, which is preventing everyone from keeping themselves safe and keeping their community safe, and preventing public health from having a clear picture of infection rates and positivity rates in daycare settings. I don't really know why there hasn't been more availability of different testing options for youngest kids in daycare settings particularly. I mean, we do know that the NP swab is the gold standard because it'll give you the most precise and specific results. So that is sort of, I think, a push factor for trying to get as many people tested with the gold standard test as possible. But I do think that in the little kid context, you want to get more people tested, and maybe like that is a sort of something you need to work on more now by presenting better options to families. As I wrote about in my story, in April, there are finally efforts underway to implement daycare testing strategy led really by SickKids and also other testing partners in Toronto Public Health. And, for a daycare family, I do really feel like, why hasn't this been in place sooner? But, I think it's one of those things where this pandemic has been so resource intensive. There are so many problems to troubleshoot. Schools were a really, really, really huge sort of sector that also needed better testing strategies. With so many more students to worry about. So from what I understand, what happened was in April, after the stay-at-home order was implemented and schools closed, but daycare stayed open, it suddenly brought all these daycare cases into view, and also daycare cases were growing. And I think there was more feedback coming from families about how awful the testing process is. And I think there was this realization, and also now some time and capacity to devote more resources to addressing the daycare testing problem. And so SickKids now is being, daycares, when they have outbreaks and exposures in Toronto, daycares are referred to a hospital like SickKids, which now has really child-friendly testing options. For example, the spit test, which can be used for kids 3 and older, or there's a sort of nose and throat swab that is much more gentle. And Michael Garron Hospital is now sending take-home kits to daycares where parents themselves can do just kind of a light swab inside the cheeks and in the lower nostril, and to see if that will improve testing uptake rates, which, for schools, from SickKids experience, before in the fall and winter, when there was a dismissed cohort, something like 25 to 30% of kids only would go for the testing that had been recommended. But once they started sending these saliva kits home for people to do the test themselves, the uptake rates were boosted way up to 75, 80% in that ballpark. So Doug, to answer your question though, like, why hasn't this been rolled out more widely? My question as well, but speaking to Dr. McCready at Michael Garron Hospital, for example, she stressed that it was one of those situations where people were so tied up with so many pressing issues. Schools was such a big issue, but it also takes time to kind of validate some of these testing options. Like, just because you supply a family with a take-home kit doesn't mean that they'll want to use it or that they'll use it properly. You kind of have to evaluate these testing options and how well they also work in a real world context, I think. And she explained to me that Michael Garron Hospital had only recently validated their take-home had been working with the Children's Hospital in Eastern Ontario, the CHEO Hospital in Ottawa, helping them validate those take-home tests for their catchment out in Ottawa. And this has only recently happened. So there's these processes that have to, I think, be undertaken before these things can be picked up and sort of scaled up to the wider community. So that's my best understanding of the overall situation. But perhaps Doctors Allen or Banerji might also have some insights.
I think, Jennifer, you've covered it beautifully, honestly. So that's wonderful. I'll make 2 points. Number one is that, and you've captured this, it's really important that the testing methodology is properly validated. You don't want for there to be an undercall or overcall in terms of results. You don't want to be having false negatives or false positives. But absolutely, the work is being done to develop more child-friendly approaches, such as Jennifer's beautifully summarized. The second consideration, which one has to remember when one thinks about how one's going to implement any testing strategy, is what do you do with the results? And what does it mean for a family to have a positive test result as it relates to, from a public health perspective, or from the point of view of the family having to perhaps have a family member stay home without being able to work, and then you get into discussions around supports for families with a positive test, so that they can stay home to take care of their child. So there are several things that factor into the implementation of testing in any situation, including what does one do with the results and the ramifications of having a positive test result.
We're going to be hitting the schools portion and how we keep them open. But Kris, I'm going to go for you this one because Samir Gupta is clearly a frustrated father of three who writes that remote learning is a flawed medium. When will schools reopen this calendar year? Please advocate for this. So I think my first question is, Kris, from your perspective, and covering Queen's Park, does this government want to try and get kids back in school before like this school year, or is that a lost cause?
So I think everybody knows that kids should be in school, right? That's the best place for them to be. The issue is, of course, are the numbers low enough that it can be done safely? So we haven't heard anything on this front really from the government other than they want kids back in school. But you start to look at places like Kingston, for example. There are a lot of researchers and doctors, a lot of researchers associated with Queen's University who are pushing for schools there, places like Kingston or Thunder Bay where cases are low. The schools could reopen safely in June. As teachers are getting vaccinated, their particular age groups being served, so they feel that this is a safe option and that it's good for kids to have at least some time in school. You're looking at heavy hitters like the Canadian Pediatric Society, a lot of experts from SickKids, also calling on the government to reopen schools safely where they can in June, if at all possible, because they recognize that, kids want to be in school, and they're saying if not, the province shut down schools before the spring break, which was delayed this year. So it was in April. So either slightly before or after, kids have been out of school since mid-April. And the feeling is that if they go all the way to September, that's a lot of time without interacting with peers, seeing teachers and that kind of thing. So there has been this push from certain areas to reopen schools and what they're calling targeted reopenings. Obviously, with all the safety precautions still in place with PPE and as much outdoor learning as possible, cohorting, etc., but to at least try and get kids into school for June. The other interesting thing that has shown up lately, there's the petition started by high schoolers. They're pushing for an outdoor graduation. They don't want to miss their grade 12 graduation like the students did last year. So they're saying if there's any way, if they could possibly have, if it's in a field, maybe they do the chalk circles like they do in some of the parks in Toronto, and every family could be in a circle and just stand up when the child graduates, something like that. That's what they're pushing for.
I feel bad for all the kids that have missed Frosh Week, graduations, all of those seminal moments. That's it's funny, when you're a kid you probably think about skipping, but years later you look back and you go, oh yeah, I remember that. But we have a couple. There's two questions here, and they're big questions, and it is about return to school and how we can keep that safe. So I have Joanna Oliver, who's a trustee from Oakville, who I think for the medical professionals is it. What conditions and local public health indicators must be in place for a return to school, as in prior to the pandemic, i.e., a regular return to school? And then the other one for everybody, I think we're going to probably talk about that with our medical experts, but the other one for everyone is, given the dynamic nature of the state of the scientific challenges associated with the pandemic, vaccines, schools, learning, and mental health, from your perspective, what are the public policy measures and other safety things that you can put into place to ensure the health, safety, and well-being of kids and their families? So Dr. Banerji, I think we'll do that first question with you. What do you think the conditions of local public health indicators must be in place for a return to school, a normal return to school?
So I think the key thing is vaccination, trying to get at least one dose in before school, and then hopefully two, but if not, then a second dose in, maybe the week before school starts. I think vaccination is really important. There are going to be some families that don't want to get their kids vaccinated, so you have to look at what are the implications of the kids going back to school with some kids being vaccinated and some kids not being vaccinated. I think that trying to understand what are the barriers for vaccination. All parents want their kids to be safe, and if we give accurate information, hopefully some of the people that are hesitant will say, see the benefits of school. I think having, good ventilation systems in place. If the kids are not all fully vaccinated, then we may need to use masks until there's a higher percentage of them vaccinated. And there may be situations like, if an outbreak occurs in a classroom, if the kids have two vaccines, maybe they can continue to be in a classroom, versus kids that have not been vaccinated, they may have to stay at home for 2 weeks and continue the regular quarantine. So I'm not sure how that's going to work out, but there probably are going to be differentiations as far as the vaccinated kids and unvaccinated kids. I think making sure that all the teachers are vaccinated, all the custodians, all the people working in the staff, working at schools, making sure that, again, good ventilations. Hopefully, if the kids are all vaccinated, then you don't have to do as much physical distancing, masking, and all that, but it depends on community levels, but also the rate of vaccinations in the kids. If the majority of kids have two vaccines, then I think that we're looking towards a year that's much more normal, and we're not going to be opening, closing like we've done in the past year.
Dr. Allen, do you have anything to add to that?
No, I do agree with Dr. Banerji. I think that school represents, challenges. But I must say that there are a few things for us to bear in mind. And one of them is what I alluded to earlier. One of the best strategies to get kids back to school is to keep community transmission of COVID low. And that's real important. And, and when people ask me, I say, the top 3 reasons keep community transmission low, 1, 2, 3. That's really important. Second point I'll make is a recognition of, as part of that effort, the need to ensure that the community is vaccinated, the community around the children, as well as within families. And we often think of the strategy of protecting children is one that includes protecting those around them, so family members and caregivers. But I also believe, and that's my personal view, that we should perhaps advocate more for teachers to be vaccinated. When you look at teachers around the world, and 193 countries listed in the United Nations, about 10% of them where teachers have been prioritized for vaccination. So, again, that's my personal view. I think it's a good thing for children as well if the teachers and people who work within the school organization are also vaccinated.
Kris, anything from the government side that we, I mean, obviously they're looking at case counts, they're looking at numbers, and this government obviously wants kids to be back in school pretty much more than anything. Any idea what their indicators are on that reopening path?
We've asked many times about what the metrics would be and don't get answers on it. I mean, what we can look to is the provincial government initially told school boards, you know what, plan for next year, assuming you're not getting any extra COVID funding. And then in the last couple of weeks, they've announced, 1.6 billion. So it's going to be still more personal protective equipment for teachers and students in schools. The province sent out a memo to school boards saying, plan for cohorting. That's going to be around. Plan for outdoor learning as much as possible. That's still going to be around. They've said, ideally, everybody's in school full time, but for high school students, basically they want high schools to stick with the quadmester system or something like that. They don't want teenagers in school taking more than 2 courses at a time. So you saw the TDSB, which is the largest board in the province in the country, come out very recently and say, we're going to do quadmesters all year. So it's going to be 4 quadmesters. I think some people had held out the hope that there might be the normal 2-semester system or maybe a quad and a semester, but the TDSB now says 4 quadmesters of 2 courses for about 2.5 months each. That's caused a little bit of controversy. It's a pretty compressed time frame for kids to learn courses, especially if they have a tough quadmester. When my own kids had bio and math at the same time, I mean, it's not easy. So there's a bit of pushback on that. So it's not going to be a normal year like we would normally have, just because kids won't be especially teenagers won't be in the normal semester system that they have. And they're still expecting there to be cohorting as well for all students. That's elementary and secondary.
Sounds like it's going to look a little bit similar. Is there any word about what the virtual schooling options are going to be?
So that is still going to be around. There will still be virtual schooling. So, obviously when schools were shut down a year ago, March, everybody pivoted to online learning. And what the province promised that summer was that any parents, any families who felt uncomfortable sending their kids actually into school in person would have the virtual learning option for this entire school year, which they have had this school year. The province has also further directed boards to provide that option for families for the upcoming school year. So you can either choose to send your kids to school in person, or you can choose to send them online only. And then there's, of course, times of the year where they can actually switch back and forth. If you feel uncomfortable with your kids being in school and you want them learning at home again, they can do that, or vice versa. And that is actually one thing with the quadmester system that works quite well, because there's such short periods of time that kids can switch back and forth. So that's really the kind of indication that we've gotten from the province right now.
I believe this is our only anonymous question, and I'm gonna paraphrase it. And Dr. Allen, you actually mentioned it a little bit, but is basically, and it speaks a little bit. It's a tough question, and it does speak a little bit to vaccine hesitancy. Question is, will non-vaccinated teachers be permitted to return to in-class teaching once schools open? Does anybody have an answer to that? I mean, you know what, Dr. Allen, I'll ask you. I mean, you just said that you want more teachers to be vaccinated. It makes sense, but I mean, I don't know if there's any way we can. This is a civil liberties thing. We can't force people to do this, right?
That's correct. At the moment, vaccination is not mandatory. So it means that people would not be prevented from going to work, or in the case of schools carrying out their jobs. It might be, though, that based on local public health guidance, the nature of one's job might change if there are outbreaks or cases occurring within the school environment, or the same for workplaces. So generally, it's a principle where there isn't mandatory requirements for a particular immunization, that the changes relate to what one does in the work environment rather than being excluded from the work environment.
Kris, anything from the government on this? Yeah. Oh, sorry. Dr. Banerji.
I'd just say, like, for example, if someone chooses not to get vaccinated, the schools may say, okay, well, you can be one of the online teachers. Or if there's an outbreak that occurs, then, you know, in a classroom, it would probably be the teacher that's not vaccinated would probably have to quarantine, as we're doing now, versus people who've had 2 vaccines, maybe they won't have to quarantine. So there probably will be some changes depending on if someone's vaccinated or not.
Kris?
I was just going to say, yesterday, the health minister, she was asked about summer camps and should kids be fully vaccinated or have at least 1 dose before going off to summer camps. And she made the point that no, it's not going to be mandatory for students or staff, but it's something that camp operators could do up to them. And the camp operators that the Star has spoken to have said, look, it's not going to be mandatory. It will obviously be encouraged, but not mandatory. On the other end of the spectrum, if you're looking at post-secondary, there's been a lot of talk in the States, and I think about 100 post-secondary universities and colleges have said, if students want to return to school in the fall and they want to return to classes in person, then they have to be vaccinated. I don't know of any institutions here that have decided that. I think some are looking into it, but it's definitely a trend in the States that if students want to be in person, they want to be on campus, that they have to be vaccinated. Otherwise, they're virtual learning for the year.
Jenny, this is also an issue with daycares. And obviously, as you mentioned, they have been prioritized, but it's a lot harder for a daycare worker to do something virtually, I would suspect. Any idea about that on that front?
Yeah, sort of in line with what everyone else has been saying. There's no clear sort of sense yet as to what policies might form around vaccinations and, you know, and employees who choose not to be vaccinated. But as you point out, it is a civil liberties issue. You can't force anyone to be vaccinated. But yeah, that's a really good question. And, you know, I also think that listening to Dr. Banerji, maybe the unvaccinated staff will have to continue with masking, whereas the vaccinated staff can, you know, now throw their masks in the bin or whatever they want to do with them. And, you know, I think over the summer, you know, we do have an advantage of this period of time where I think local boards, public health units can really do the work that's necessary to try and overcome some of the hesitancy that might exist among teachers, childcare workers. In childcare, particularly, a lot of ECEs, early childhood educators, you know, come from racialized communities, for example, where there's a lot of mistrust, understandable mistrust of medical establishment, of government. And, you know, we know from a lot of reporting now how important it is to enlist local trusted organizations to work with individuals to discuss their concerns and overcome their hesitancy. You know, I think with the gift of the summer break, you know, there's a lot of that time should not be squandered, and those efforts, you know, a lot of resources should be devoted to, you know, those types of efforts that are now working to try and help people address their concerns over vaccination and to try and really boost those coverage rates, particularly in schools and in childcare facilities, which are so critical and essential for all of society.
Kris, I'm going to come back to you on this because I think we chatted about this once on one of our chats on the show. Rick Singh writes, I feel like my kids have lost a year of school. One was behind before and seems more so now. What is going to be done about trying to catch up those children? And I think we talked about how in other jurisdictions, in other countries, people are already talking about this and sort of figuring out things to do with this, but I haven't heard a lot here. What do you have to say to that?
So what we've seen in other jurisdictions is, for example, PEI in PEI, early on, they identified that, there were going to be learning gaps, that kids were going to be behind. So they actually started sort of culling the curriculum and just getting it down to the essentials for kids, just to make sure that everything was covered and kids had a solid base. We've seen the UK, for example, the Netherlands, they have large-scale studies. They've seen that kids are behind by about 1 to 2 months, and they've already planned things like intensive tutoring for kids, free tutoring. I think Quebec has also introduced free tutoring for kids. Here in Ontario is that you've got individual boards like the Toronto District School Board, of course, which is the largest board, and they've got a great research department, and they are looking into the learning loss. Province-wide, there's not any province-wide data that's going on, and that's a concern for some people because they say you really need to know where these gaps are, monitor and address them. But we have the TDSB data. What it's shown is that high schoolers, for the most part, are doing okay academically. If they were struggling before, they're still struggling now. But in general, grades have remained the same. The issue kids. So grade 1, the reading levels have gone down, and they say it's a significant amount. It's like 3 to 10 percentage points, which is a lot. So that's the gap that they're going to have to be dealing with. The province has announced, I think it was 62 million for things like tutoring and other supports. I think what boards are looking for and what teachers are looking for, and some experts, they're saying we need some kind of coordinated effort. We need to know exactly where the learning loss is, what it is, and some kind of plan to deal with it, which we don't have right now at the provincial level.
Dr. Banerji and Dr. Upton, this is a question too from Bill, who writes, my kids are really looking forward to hoping to return to in-person learning come September. However, their mental health has been up and down this year. The isolation from their peers has been difficult. Do you think that there are more resources that schools should be allocating toward things like mental health counselors to help deal with the post-pandemic issues that some may face? Dr. Banerji, any thoughts?
Yeah, absolutely. I think that this has been a really, really difficult year for kids. There's increased rates of anxiety, depression. There have been some kids that have been, like teenagers, that have been disengaged, and some of them actually dropped out. So how do we re-engage these kids? I think part of it is like we're trying to improve their ability to learn, but also we've been through the worst health crisis of our lifetime, the worst health crisis of the past 100 years. I think what we need to do is probably take off the pressure. It's like, yeah, you're behind a couple of months. So is everyone else. But we're going to be okay. We're going to get through this. And this is not because you have these issues. It's normal to feel anxiety. It's normal to feel stress from what we've been through, but it's going to be better in the future. And we're here to re-engage and to help the kids. But I think we really need to take the pressure off. So I think it's been a very, very hard year for kids, and we do need supports in for their academic, support them academically, but also as far as their mental health. But again, reassuring them. I think it's been hard because the lack of control in what's been happening, the uncertainty, we don't know, are they going to school, are they not going to school? That lack of empowerment is really hard. And I think once we have kids back in school, if they're feeling more secure, then that's the way to move forward. But also, you're a little bit behind, it's okay. It's okay, because everyone's probably going through the same thing. So again, reassurance, saying that we'll catch up, we'll find a way to get through this. And I think that's taking the pressure off is the way to do it.
Dr. Allen, any thoughts about more resources for mental health, particularly perhaps in schools?
This is really, really absolutely crucial. It's really important to recognize first that to help protect the mental health and well-being of our children, we need to get them back to school. So we have to work on all the things we talked about earlier, including community transmission and vaccination rates, to get schools to reopen and that they be done in a safe manner. The second point is that while kids are in school and beyond, mental health supports are going to be absolutely essential. But it's important to recognize that those supports should not only be directed at the children. We need to also remember the families as well who are stressed and teachers. And so it's a large group of individuals who do need support. We also need to recognize the various equity considerations with respect to families in hot zones and the types of supports they might need versus people who are in low prevalence areas. So mental health supports are absolutely crucial.
I think I'm going to address this one to Kris first, but then also Dr. Banerji, because you mentioned this. It's a question from Sandy, and it's about ventilation in the school. The building is an older design with many classrooms having no outside windows, so within 4 inside walls. I have to assume the school does not have the budget to improve the ventilation system. I've asked, but received no response. Is this a deal breaker in terms of safety? My children have asthma. Now, Kris, I want to talk to you first because I do believe the provincial government did allocate some funds to try and retrofit the schools and some of the ventilation systems. Is that correct?
Yes. So the province announced some money last year for schools to upgrade ventilation systems for the fall. The issue, of course, at that time, and remains the issue with ventilation systems, is it takes a long time to tender out these projects and get them done. I mean, I think the Toronto School Board was saying, you know, the money's great, but we can put out the tender now and we can't get it done for a year. So I think you sort of saw a lot of stopgap measures like HEPA filters in classrooms and things like that. The federal government and the provincial government have both ponied up some money for this upcoming school year. But again, the question is of the timing. How much work can schools get done that they need to get done in time for the school year? So that sort of remains the big question. I think the federal government announcement was roughly $500 million and the province putting in about $115 million. So it's a lot of money. It's just, can these projects get done in time for kids to return to school?
Dr. Banerji, a tough question. Obviously, you know, someone's asking, is it safe for my kids to go to school because they have asthma? But you mentioned ventilation earlier. What are your thoughts?
Well, I think that, well, again, vaccination, reducing the community spread, all of those things make it safer in school. But I've thought for the past year, I've been talking to COVID patients for over a year, and I've talked to thousands and thousands of patients looking at their risks. And I believe over a year ago that COVID is actually airborne. And there's been some controversy, but to me, there's no possible way that it's not airborne. And so ventilation and trying to improve the air circulation is really important, but so are other things. And so again, if you can get the kids vaccinated and make schools safer, then the risk of a child, even with asthma, getting COVID is much, much down. Also, the community rates of COVID go down. But ventilation is something that is one of the factors as far as the spread and control of COVID.
Just do a plug right here. The Stars Sarah Most Ahead. I just wrote an incredible piece about ventilation in schools that people should read if they have not. So, you know, it's funny. I said to this panelist at the beginning that I'd be surprised that if we could get through all of the questions. And I thought that this last question, because I was like, oh, as if we don't have enough to worry about, but we are actually here. And so this is from a fellow doctor, Dr. Travis Barron, MD. In Australia, for the first time in the summer, they saw a wave of respiratory syncytial virus, RSV. This feeling is maybe related to kids not getting their RSV immunity during in-person schooling during the winter. Do you anticipate other clusters of non-COVID illnesses in school once things reopen, given how long kids have been kept from each other, meaning we have less herd immunity for other diseases? Dr. Upton, I mentioned this to you sort of as a joke at the beginning, but you were like, that's a good question. So I go to you first, sir. Is this something that we need to be concerned about? Basically, that our children, because they've not been around other kids, may be susceptible to other diseases?
You know, it's a great question. It not only applies to children, it's in adults as well. And the argument here is that in a regular year prior to COVID, you'd have more people who would have been exposed to these various respiratory viruses, including the respiratory syncytial virus, RSV, but also other viruses, parainfluenza, influenza. And so we would have had infection of varying severity, and we have some degree of immunity entering the subsequent season. And so what we've seen over the past year with the great infection control measures directed at COVID, we've seen very few cases of RSV, very few cases of influenza. There hasn't been an RSV season or an influenza season or any of the other respiratory viruses because the infection control measures that we put in place, staying at home, various hygiene measures, all worked so well. So the question then is, going into the next respiratory virus season this fall, will there be enough background immunity to prevent us from having a more severe respiratory virus season? The answer is, the verdict is still not in. There's some signals from Australia, as you mentioned earlier, but it is an important issue that requires close scrutiny. And we just have to watch that very carefully. But that could happen for the reasons that I've stated, and that is we'll be going into the upcoming respiratory virus season without enough immunity that might have been picked up from the prior season.
Dr. Banerji, anything you want to add?
I agree with all of that, but also it depends on how much the kids remember to wash their hands when going back to school. But for something like RSV, it tends to be more severe the younger you are. So some of these viruses, if you get RSV when you're 5, it's very different than if you're 4 or 5 months of age. And so you may have a lot of RSV out there. I suspect that we'll have eventually a rebound of influenza and RSV and things like that. But it depends on the age. They may not get as sick, but I guess that, yeah, as Dr. Allen says, the verdict is out.
Well, that's also something we can worry about later. And I'll say that I'm one that, wearing a mask for the past year, I haven't had a cold or a flu since. So I got to say that that's worked for me. Listen, those are our questions for today. I really want to thank this stellar panel, Jennifer Yang from the Star, Kris Rushowy from the Dawn, but in particular, Dr. Upton Allen from the Hospital of Switzerland and Dr. Anna Banerji from U of T, who is with us from a vaccination clinic right now. I want to re-add. Honestly, particularly the medical professionals, I want to thank you so much for your time and expertise today. And as for my stellar colleagues, well, it's always a pleasure talking to you guys. Nice to see you as well. To everybody else who's been watching the subscriber panel, we really, really want to thank you for your time and your questions. Be safe and be careful out there.
Thank you.
Thanks. Bye.